Good afternoon to all the viewers of Mukul Madhav Foundation, of Barnardo's, and of British Asian Trust. I have here, as they always say, ladies first. So firstly, I will introduce Ritu Chavleji. Rituji, welcome from Mukul Madhav Foundation.
Thank you so much. Thank you.
And then I have
pleasure to be.
Javed Khan, CEO Barnardo's. Hello, Javed.
Hello, Salman. Delighted to be with you, Salman Bhai.
And Hitan Mehta, Executive Director of the British Asian Trust. I'm Salman Ahmed, the moderator for today, and I find myself extremely fortunate to be part of today's initiative in particular, because I think it matters a lot to the world, and we'll find out as and why. So if possible, I would like to request Hitan Mehta with the British Asian Trust, if you could commence this wonderful forum and this session.
Thank you so much, Salman, for having me here today on behalf of the British Asian Trust. Really, just to introduce the work of the Trust, for those who don't know it, it was started in 2007 by His Royal Highness the Prince of Wales, largely on the back of his trips to India and Pakistan in 2005 and 2006, and a deep desire to see how he might be able to support those who were in the greatest need across South Asia, in India, Pakistan, Bangladesh, and Sri Lanka, and see how to connect the diaspora community based here in the United Kingdom to good charitable work across South Asia. And last 13 years, the British Asian Trust has been able to reach over 4.5 million people and supported the lives of millions across the region. Our key areas of work are in the areas of livelihoods, education, anti-trafficking work, mental health work, and of course, at the moment, right now, given the COVID pandemic, our work has really pivoted very quickly into looking at how we are helping save lives of those in most need across the region right now. In that end, we've launched an emergency appeal, and we've been very grateful for the amazing support that we've received from the diaspora community here in the United Kingdom and those really who want to help South Asia at this most difficult time. So that's a little bit about us.
Javed Khan Barnardo's, I will come to Refugee as she's perhaps one of the co-hosts of having us on her platform. So Javed, please a lot about Barnardo's for everybody across the world to know.
Thank you, Salman Bhai. Delighted to be here with you in such illustrious company. Hi, Hitan. Hi, Rituji. Lovely to see you again virtually. So Barnardo's has been around a very long time. We're 154 years old. We're essentially part of the fabric of this great country of Great Britain. And since 1866, Barnardo's has had one purpose, and that is to strive to support the needs of the vulnerable children and young people in this great country of ours. And I often, when I say that, people say, particularly people from overseas, they say, what do you mean vulnerable children in Great Britain? This is the sixth largest economy in the world, and people find it hard to understand how there can be vulnerability here. But if I just share with you that, there are 4.5 million children who are living in poverty. These are pre-COVID statistics, that 1 in 4 14-year-old girls in this country of Great Britain has social anxiety and is not being supported for mental health issues. And then if you add to it all of the other statistics around children being exploited criminally or sexually abused, those children who don't have the gift of having loving parents or a family to rely upon, who are in fostering or waiting for adoption, and the list is endless, really. That is modern day Britain. And Barnardo's had stood strong for 154 years to stand up for those children and young people. Now we are the largest children's charity in the United Kingdom. We employ over 8,000 paid staff and 20,000 volunteers. We support about 300,000 children and young people, their families, and carers every single year. In the United Kingdom through over 1,000 services across all 4 parts of the United Kingdom. So Northern Ireland, Scotland, Wales, and of course, England. And I've been the chief executive, huge privilege to be the chief executive for the last 6 years. And, you know, I often say to people, come and visit Barnardo services. And people say, yeah, we'd love to come. But I say, do one thing, bring a handkerchief with you, because I dare you not to have a tear in your eye when you come and see the work and the plight of the most vulnerable, deep beneath the surface of Great Britain, to meet the children that we stand for. We don't do the easy stuff. And COVID, of course, you know, it'd be remiss of me not to mention that. All those statistics I just shared with you are pre-COVID. The situation has got much, much worse in the last 12 weeks of lockdown. More children are exhibiting mental health issues because of isolation, because of them being locked in their homes. More children are living in homes where domestic abuse is now being exhibited. The figures have just skyrocketed. And yet the support services that they should be able to rely upon, they cannot access them because of lockdown. And our greatest fear is that as soon as all of this lockdown ends, and when children flood back into the schools, which will probably be September now rather than before that, we are going to see an enormous spike in the demand for support here on in our streets. And the services provided by the state just will not be able to cope. And that's where agencies like Barnardo's will have to step up.
Thank you for that insight, Javed. And I will come back to you on a few questions I've got, and you know, perhaps I've been even asked. And the same would be for you, Ritu Prakash Chabreji. Over to you for letting everybody and all of us know about Mukul Madhav Foundation.
Thank you so much, Salmanji. Javedji, Hitanji, very nice to see you virtually. And again, hearing how we are connected and how we've been brought to this platform, I must thank Salmanji for this opportunity. Mukul Madhav Foundation is 22 years old, was established here in India, and I'm happy to say that we have now a registration in UK as well. And that brings a great link between India and UK once again. We are working under many, many verticals, but with children and children's health and children's education. So we're in health education. We're doing water conservation, sanitation, as in providing toilets and you know, the services that we can to various different government schools and municipality schools. We're working in almost all different verticals. In India, we have a CSR policy which has been implemented 5 years ago. I also have my foundation being the CSR partner for Phenolics Industries. And this is where we have grown from being a small NGO to growing and spreading our wings because of the funds that we do get from Phenolics Industries. Important to say that CSR policy definitely has brought out a lot from corporates and companies, and it's been a great mandate because it's 2% of the profit that the company makes. And I'm happy to say that Phenolics gives me 3.50%. So much higher than what the government has really implemented. And at this present moment, what we are doing is working very hard for COVID. And the last, well, since the end of February, we've been working with COVID and preparedness for COVID, where we've prepared with, you know, the ladies that we're supporting for skilling and livelihood. They've been helping us make the masks. We've been distributing cloth masks. Also, preparedness with the PP95 masks. Everything that we thought would be needed, we started procuring this end of February. So much before the pandemic really hit India, and we were prepared for that. So we've been supporting a lot of government hospitals with whatever they require. Children that are suffering at this present moment, as in the cerebral palsy, children that we look after, we have 900 under our wing. These 900 children are being supported their physiotherapy, because as you know, if they do not have their constant therapies happening, they become stiff and they go sort of, they're sort of turning backwards rather than going forwards with their therapies. So we've been doing something very different, which in fact started yesterday, is that the local television has permitted us in the villages, or well, in the city of Ratnagiri, to have our own sort of half an hour, 30 minutes in the morning and evening, where we're doing all these therapies over television because of the connectivity. So our children are into rural interiors, are not able to sort of connect via any other medium. So this has started off yesterday, doing extremely well. And like I said, concentration is more on health, education of children, but of course that's expanded over the years. So we're working with many projects and verticals. So that's a little bit about us. We've been working closely with UK at the moment, supporting National Health Services with meals for doctors and nurses in various different hospitals as well, through the foundation that we've registered. So this is how things are going, working well with COVID at this moment. People keep talking about COVID, having, there's nothing to do and we're getting bored. But believe me, these 3 months have been really, really busy with us, where we've been looking after the migrants. We have huge amounts of migrants moving around in India at the moment. So Mumbai, back to villages, etc. So supporting the migrants, supporting hospitals, supporting cerebral palsy children has become more of like a challenge, but we've met all the challenges that have been coming our way. So that's us in Mukul Madhav Foundation.
I'm sure it's a lot more. Javed and Hiten, I had the pleasure when I was in Pune in particular last year of visiting one of the hospitals where Mukul Madhav Foundation, and I remember it was a an old ward but newly set up with the initiative and the assistance of Mukul Madhav Foundation. And with I won't use the word pleasantly surprised, but I was very pleased to see that how equipped it was, what sort of things were being followed. And a lot of these mothers who'd come from villages and other areas. So it wasn't just them from Pune. And this is my first-hand experience, and I was very pleased. And especially, you're not saying it because you're here on the forum, the devotion and the passion I see. And I think for anybody, unless that devotion is there, such initiatives cannot happen. Whether it's Mukul Madhav Foundation, I've seen your entire family support, and I think it's a great cause, and that's one of the reasons. I feel close to it, because knowing and seeing something which is doing well for mankind, and especially children in particular. So, Javed, between Barnardo's and Mukul Madhav Foundation, I think there's a synergy of many things. Both your initiatives and your causes are there, but children particularly come in place. And I think, as Mukul Madhav Foundation is a UK-based charity as well, Barnardo's is there, and we were already thinking of doing certain things. And I'm sure we will. So thank you so much for letting us know. And then towards later on, I will also ask how, we did a session with the Salim Merchant and Salman Merchant last week. Where also we endorsed Barnardo's and we endorsed the British Asian Trust. We spoke about your initiative as well. And they had something called Zaria, and you very kindly, came forthcoming the very next day in support of Zaria. So I think, with these conversations, it's very nice for people to know that how they can come forward and support. Javed, back to you for Barnardo's. If you recall a couple of years ago when we were looking, how does the BAME community, Javed, would you like to explain to people when I use the word BAME, what does that stand for? B-A-M-E?
Black and minority. So Black, Asian, and minority ethnic. It's meant to be a catch-all phrase for basically all non-white groups.
Yes, but I don't want to spend too much time on COVID-19, because I know that everybody in the media keeps us all quite aware of whatever is happening. But Rituji, in India right now, you get mixed stories. Are the cases generally increasing as we get to here?
Well, Maharashtra definitely has a very, well, on a daily basis. I mean, the last 1 week, we've got many more cases happening. We have, because of the densely populated slums that we have, the migrants are on their way out. There's a lot of sort of brewing and breeding at this present moment because there has been a lockdown. However, I don't feel that the lockdown has been a very successful lockdown. While we were, now that we've started opening out, we haven't got enough measures taken for us to feel that we are safer out there. So I feel the last 10 days, I would say 7 to 10 days, we've had many cases coming into, at least in Pune, we see a lot of cases. And if I'm speaking to people in Mumbai, doctors in Mumbai, again, the same thing. So we are the two cities in Maharashtra sort of high with the numbers and growth in the numbers.
That's sad to know. Hidden, over to you now, because you've been hearing, whatever you said, what Javed has said. Hidden, now, the last 3 months in particular for the trust, and I know working overseas, whether it be in India, Pakistan, Sri Lanka, how is it for the trust? How have you been supporting and what has it been doing?
Salman, thank you. 3 months ago, His Royal Highness the Prince of Wales helped us launch an emergency COVID-19 relief appeal. We were starting to see the numbers ramp in countries like India and Pakistan. And actually now, when you look at the statistics ongoing, the numbers in India and Pakistan is rising. As Rituji mentioned, Maharashtra state, Delhi is also another place in India which is now starting to see huge rises. But the biggest issue we were identifying, especially in India, for example, was the area of migrant laborers. There's 400 million people who are migrants, essentially, who move from cities to cities looking for work. They're all now heading back to their villages, and many of us had seen the pictures of people on the roads of India trying to return to their homes in this sort of maddening situation that they were encountering. And what we've tried to do is identify, as the British Asian has, is good partners on the ground to be able to do the work with them, so that we're not really building more infrastructure ourselves on the ground. And so we've been supporting good organizations there. Gunj and Jan Sahas are two organizations that we've partnered with, where we're looking to at least be able to save about 100,000 lives of migrant workers in the first instance, really by being able to provide them with the basic requirements of rations, their food, because again, the biggest single issue they're facing is that they've got nowhere to stay, they're heading back home, but again, they have recourse to being able to find the support that they need. Equally in Pakistan, we've started to see those numbers rise as well now, and this morning the government there have definitely been describing that the numbers could become more serious over the next month, and especially over the next few days, maybe even, because they're seeing increased numbers there. And again, we've been partnering with organizations like Ahwat in this health network ground, these organizations who've been able to do work on the ground, and we've been working with them for a number of years. And so we know that we are able to trust them to be able to deliver the work that needs to happen on the ground very quickly. We're also in Pakistan been seeing a lot of the ability to be able to transfer very quickly to people, to be able to put money into their hands, to be able to go and buy their own rations on the ground as well. And most importantly, Salman, in and amongst all of this, is the reporting, monitoring, and evaluation of that work. So it's not just, here's some money, go away and do all this work. It's our teams on the ground in India and Pakistan, for example, on a daily basis, being able to monitor the situation and understand what's going on. So we've really seen how we've been able to ramp up work there. But equally, we've seen the diaspora here in the UK really get involved in a big way. We had, as you know, something called Big Curry Night in a few weeks ago now, where we got various people to be able to support their local curry houses. Those communities here in the UK have seen the downturn in their businesses as well. Purchase a curry and make a donation to the British Asian Trust. We saw involved across the country, including a whole host of celebrities, including the likes of Piers Morgan and Amy Jackson and all kinds of others as well. I feel opportunity for everyone to be able to try and get involved and see how they can support.
I mean, knowing about Mukul Madhav Foundation, I'm sure from before as well, and again, whatever we heard today, how do you synergize? How could we see the British Asian Trust supporting the foundation? And have you been in Pune and seen the work and the type of work they're doing at all?
Yeah, so we've had we've had a couple of conversations with Rituji and the family. The Hinduja family as well have been great supporters of the work of the British Asian Trust. Yes, I feel like I've grown up with GP Uncle giving me lots of advice over the years as to what I should be doing and what I shouldn't be doing as well. But in addition to all of that conversations, our teams are in touch over there as well. I was due to visit Pune to come and see some of the work as well. I'm hoping that I'm still able to do that post various kinds and the ability to travel again. And so I'm sure we'll be able to find areas of being able to support. But again, I think the main thing has been that I think organizations on the ground are doing good work. It's about seeing how we're being able to do these at scale. And that's the real driver in our minds, that how can you try and do some of these initiatives on a big scale across the country? There's a huge need. And again, millions of organizations are involved. But again, how do you try and drive these things to a larger scale? And you can only do that in partnership, we believe, with others. Where, you know, our conversations definitely have begun, and definitely, you know, I'm sure we will find ways of working together in the future.
Absolutely. I think, Hitin, it was a pleasure meeting you. And also, if I may elaborate on that, I mean, what you said about partnerships, exactly what we say is collaborations and not competition. The more we collaborate, the more hands that we sort of hold for each other, we're able to give back more. And that's how Mukul Madhav Foundation has been working. We have lots and lots of partners. And more than anything, being the CSR partner for Finolex, 50 people working in, pan-India. So we're able to reach out, for example, 20th of May, or the Amphan cyclone in West Bengal. We were probably the first people to arrive there because we were prepared to help out. And we could hand out sanitary towels. We were there with ration. We were there for everything within 5 days. Then hit the Nisarg cyclone, for example, which was the west coast of Ratnagiri and Raigad. We were there within 1 week for the shelters and providing rations and everything. So yes, it's about having a spread and being able to work in the comfort zone of knowing that we have our reach everywhere. So we could probably pick up on that conversation whenever we get a chance.
If I may join in, as far as the Mukul Madhav Foundation goes, I must admit that until last year, I had never heard of it until I met Rituji and spent a few amazing hours with her and read about, watched some videos and so on. And how thoroughly impressed I was that in the environment that the Mukul Madhav colleagues operate, the difficulties that they face, environmental, political, geographical, the weather as well. I can't remember the last time I was that impressed by the work that one agency is doing in all of those circumstances. And our values seem to align instantly. And that's why we committed to see what we could do together.
Yeah, we were hoping that fundraiser that we still have pending. So hopefully when things simmer down, we have to get there. But
Yeah.
Thank you so much. I really appreciate words. Thank you. We are really trying to work and spread our wings as much as possible in every direction that we can. So always really work with whatever and whoever comes our way. Thank you.
No, it's wonderful to see. And if we look at Barnardo, very much a UK charity, doing things for the vulnerable children across the United Kingdom. Mukul Madhav Foundation out of India doing things, for across, like you said, pan-India. And Hidden British Asian Trust out of UK, but doing things for across different regions and countries. So, as much as you're all initiatives, but very, very different profile, and one cause, you're supporting and helping the vulnerable and the needy. I want to, and the thing is, the minute I say, and I said the sessions we'll keep it brief. There is so much to learn from, not just for myself, or whoever else who's listening now, and who will then later on listen to the recorded across different platforms. Mental health in all this, I believe, is a very common subject, and especially in pandemic. Rituji, very sorry to hear about somebody you'd probably known a lot better than I've only known of him. Sushant Singh Rajput, I believe, we got to know, a very promising a Bollywood artist. He passed away this morning with suicide, supposedly, or whatever has come out. He was under depression for 6 months. So it doesn't matter what fame you have, what name you have, what money you have. Anyone can get depressed. It doesn't have to be the ones who are not privileged. The privileged ones also go through this. So, Hiten, I know that mental health is one aspect of British Asian Trust, very strongly supported. Would you like to just say a bit on it, and then I'll ask to hear from Javed as well. What feedbacks has he got from his team of this pandemic and current pandemic situations with mental health?
In the area of mental health, I think it's that sort of silent killer that so many of us don't understand. I think it's a hidden area, especially in the diaspora communities here in the UK. Not many people want to talk about it. Everyone has an uncle or an auntie that we know that will have suffered from some kind of mental health depression issues, and again are usually hidden away by the family because it's something that people don't want to talk about. And then when you translate this across to South Asia, in countries like India and Pakistan, there is no infrastructure with these things. Having worked in the area of mental health in Pakistan since 2013, the biggest thing you see is the fact that there is such a lack of understanding at the grassroots level. I visited our mental health work in Karachi a couple of years ago, and the biggest single thing that you start to realize is that people have been hoodwinked into believing that it is some kind of devil that has possessed people. A lot of money has to be given to remove that devil from people. And these sort of myths that exist within the system are really actually terrible, because again, lots of money is then given away that in the hope that the person will be made better. So the trust has worked very hard with organizations on the ground to create a community-based mental health model, and really trying to engage people at the most basic level. We've also seen that some of our models, for example, where we've used technology, so using an app to be able to provide services directly to people via telehealth medicine, has been really hugely successful. And the model that we were backing in the area of mental health in Pakistan has actually been adopted at government level, at a really nationwide level, very quickly during the pandemic. Because again, this took advantage of the fact that you'd have lots of women doctors who weren't practicing, because once they got married, they would be expected to stay at home. They were suddenly being able to use the app as a way of being able to interface with patients from the comfort of their own home, staying within their culture and tradition, but being able to then provide a service for which they've been qualified vastly. So we've seen that these kinds of things, especially in the area of mental health, that you can really see how you can use technology to make a difference. And we've seen that happening a lot here in the UK as well, with various models as well. But the real thing with mental health is how you start a conversation. And we're fortunate that in Pakistan, for example, we have, with a charity partner with the Pakistan cricket team, Rahat Fateh Ali Khan, Salman, thanks to your support, is another ambassador of ours there, Mahira Khan and others, have really helped engage a conversation that it means that it's okay to talk about these things. And I think that's the biggest first barrier.
You say this about what you're doing there, but what about in India? And Rituji, how extensive is mental health an issue across India? Of course, the size, the population, everything is in 100-folds of anywhere else. How strong of a concern and problematic matter is it across India?
Well, I'm glad you're asking me this question. That's another vertical that we work under. Over the last 6 years, we see that mental health has been a prime, prime focus for a lot of people. People are coming out of the closet, wanting to speak about it, looking for the right people. So over the last 5 years, we've been having concern for mental health from UK. Coming into Pune, we have a program that we set up for caregivers, as well as teachers and those who are working in prisons, so that they know how to deal with depression, with mental anxiety, etc. So we have a 7-day, a 5-day program that we have, and we have psychologists and psychiatrists coming in from London. And this has been taken in very well. So on average, we have about 140, 150, people, from various different backgrounds coming and joining us. But what we did last year, which was very, very interesting, is that we could convince the local education department to enable us to talk to teachers, to speak to teachers in municipality schools, in the government schools, who have had no formal training on how to identify a problem. So we managed to do that. We did this in about 27 different schools. So we managed to bring in about 300 odd teachers. And over a mandatory weekend, a Saturday and a Sunday, is when the district health officer and the education department collaborated with Mukul Madhav Foundation, and we were able to spread a lot more information on identifying, as well as caring and encouraging them to come out and tell us about the problems they see, and not to be worried about what the parents are going to think about it. So we trained them 10 days before the UK team came with the local team. Then we collaborated that. Then we had this training going on. And believe me, these 300 teachers were unaware that there is so much that needs to be looked into. So it's not about educating, but also knowing that children are at peace. And that's what we've been doing constantly. And at local level, plus the teams that arrive, they have had a great, great networking years that we've been sort of interacting with them. So mental health definitely is a vertical that needs, is very challenging. Like Hitenji just said, that they feel that it's a taboo. It's like you need to be doing prayers in order to take that out of the system, rather than actually scientifically or health reasons are behind this. They don't want to accept it. But I feel over the last 5 years, there's a lot of boundaries that we have crossed, and that's what we're aiming to do more and more. But interesting enough is to work with those in the prison. They have about 6 or 7 representatives that definitely love to be in these interactions, because they learn a lot. There's a lot that is given back to them as well. So we're working not just with children, but different caregivers in different places, old age homes, prisons, schools, colleges, doctors themselves who are not able to deal with certain patients. They make sure that they keep those ready, and then there's an interaction and everything. So I think it works really well when you have people from different walks of life, different places come together, collaborate on this subject as well.
Thank you so much for enlightening us. Javed Khan, all yours. And I wanted you to be left last to this particular subject, please.
So I'm really glad you raised the topic of mental health, because it's such a significant factor, as we just heard, in South Asia. But actually, there are a lot of parallels with what's going on in Britain here and now as well. And of the 1,000 plus programs that Barnardo's runs, there are 3 major headlines of big services that we run. And so, for example, one of those is children in and leaving care, fostering and so on. Secondly, children who are abused or exploited sexually. Second one, and the third big one for us is mental health, what we're talking about now. And I'm on record at platforms and various speeches and articles before COVID of describing the mental health challenges in the UK being in crisis. Not enough resource, not enough support, and not early enough for those that need it was what I used to talk about. Now, I'm actually not talking about a crisis anymore. I'm talking about a catastrophe in modern day Britain. And I don't use that language easily because we are a highly developed superpower, sixth largest economy, as I said earlier. And yet we are facing a catastrophe in this country in terms of supporting mental health issues. And usually adult mental health gets talked about a lot, but children's mental health doesn't get talked about enough. And so we've been doing a lot of work about this. And in terms of, people ask the question, well, what's the answer? Well, the answer is, from Barnardo's all of the decades that we've been involved in this, the answer is to provide support early, at the first sign of a signal of emotional distress, social anxiety, usually happens in the early teenage years. That's the time to intervene and provide support. It normally gets spotted by the teacher because of some kind of behavioral change, sometimes by the parents, sometimes by the GP, those who are lucky enough to get the appointment and get referred. But then, unfortunately, even with our highly developed system, we don't provide the support early enough. And that's what Barnardo's tries to do. Get the support in early, through counselors, through therapists, through intensive support, to prevent that young person from developing more severe symptoms later on, which becomes a huge drain on an already stretched system. Now, because of the company I'm talking to here today, in terms of the Black and Asian minority ethnic people in Britain, we know there is research out there that there is a disproportional impact on those young people from those communities, South Asian young children in particular. And so it's becoming better and better understood. And what Barnardo's has tried to do over the last few years, and you've been helping us with this, is to reach out to the South Asian communities in the UK. Because Barnardo's been around such a long time, it's had amazing support from the great British public, with royal patronage going back all the way to Queen Victoria, and the Duchess of Cornwall being our patron now, who took over from Her Majesty the Queen, who was our patron for 33 years. Lady Diana was our president for 12 years. So we've had great support. But actually, the modern day Britain, the BAME, the South Asian communities are growing fast. They are in their third, fourth, fifth generation, very well-to-do people here. And we are reaching out to them, and they are very positively responding to us as well with great support, because people here are saying now, well, I was born here, educated here, my children are born here, this is where I'm going to stay. I actually want to use my money, not just overseas, but I want to see what difference it can make on the streets of Britain as well. And the Barnardo's, Myra Khan is an ambassador, Bilal Ashraf, the superstar from Bollywood, Salman Khan. These people do not reside in Britain, but they have gone out of their way to help Barnardo's spread its message to the South Asian communities in Britain, to say, you need to support this charity as well. And we've been supported amazingly. So we've raised millions of pounds during COVID through our crisis appeal. There's a great example, a very successful Ramadan appeal that we had this year for the first time. We've never done one before, but people came out in their thousands to support Barnardo's, and mental health was a key issue that we were talking to them about. So as much as the catastrophe that I talk about, I actually am very hopeful. I see that at the other end of this, that one way or another, we will have highlighted the issues in a way and reached people in communities in a way that we perhaps hadn't done before. And that can only help us in the future.
Oh, very much so. I'm just going to request that, we can continue speaking, because the subject, is so close to everyone's heart, but then, there are time limitations. And what I would like to walk away with today is, ideally, Hiten, if I could, with not a lot of months ahead, that there is an association between British Asia Trust and Mukul Madhav Foundation. And Hiten, I'm only saying, because I believe I have equal, association with everyone, maybe a bit personal with one and in a different way with the other. But I think looking at it, because I have seen how, what, why, and on what basis Mukul Madhav Foundation do their things, I believe and would advocate, Hiten, please let the trust look at it very closely and extend the support, because it genuinely does beyond wonderful work. And that I would like you to see when you go there. I mean, I would not have said this if I hadn't seen on ground, if I hadn't followed Mukul Madhav Foundation. So seeing is believing. So that's a request to you, and Javed Khan, again, with the Mukul Madhav Foundation having a UK registered charity as well. Ways in which we can mutually work, where it is just like for Barnardo's in 2017, when we were mutually thinking, how do we connect it to the British Asian community? I said it's very simple, that most of us as British Asians, we live here, some of us were born here, and at the same time we believe that charity is back home, but actually this is home for us. This is the country who's given us all so much. So it's time to give back. We thought about that punchline, and so for Barnardo's, for every British Asian who's, if you're watching it, you're going to watch it later, please support Barnardo's, and go to the centers. And I think, Javed, that's the other thing we would like to do, is arrange for people. And Rituji, even when you're next in London, it'll be very nice for Barnardo's to arrange a site visit for you and vice versa. So, on this note, as much as I don't want to end this forum, is there anything else would you like to say before we wrap up in about 2 minutes time? Rituji, we'll this time start from you as a note to end today's session.
Well, first of all, it's been a great platform, like I said earlier. Very nice to see Javedji here, and I really look forward to us sort of getting together. And I was very, very close to getting to go to one of the centers, and of course it didn't happen. And we are going to plan this fundraiser that we had promised each other, so hopefully soon. And I look to welcoming all of you to Pune. I mean, you don't even have to come to Pune if it doesn't bring you here, but at least visit our our website, look at the work we do, and we are daily updating it, because we're everywhere. Basically, I mean, I really don't know from day to day what is happening, but there are lots of ways of collaborating, and I would definitely like to do something with Barnardo's in UK, because like you said, I have also grown up in UK, and I always feel that there's room to give everywhere. So live to give is the motto that I follow. Is believe that we have something where we can sort of overlap with the work. And I look forward to touching base with everyone once again, whenever possible. Salmanji, I think you'll be the catalyst to get us all going together again. Thank you for this opportunity.
Not at all. Gee, I thank the Almighty for enabling me to be part of such wonderful people, and more than the people, the cause and the causes they are. Javed, now, before we say goodbye, a note from you.
So delighted to have been part of this. Great thanks to you for the time and effort you put in behind the scenes to make this happen. It's never easy, and I know you're a very busy individual as well. And thank you to the colleagues, Hitan and Rituji, for catching up with you. And I look forward to further developing our potential collaborations. And you do fantastic work, both of you. My only message to the listeners out there is that there are so many causes out there, so many causes. The world is in such a recession coming. More and more people are going to be impoverished, out of work, children will suffer, and so on. So, my motto in life is, it doesn't matter which cause you're connected to, but stay connected. Do what you can to help in the cause of humanity. Of course, I'm biased because I think children are the most deserving, because today's children are tomorrow's adults. If we don't support them early, those problems will be stored up later on, and we will all have to support them. If you have compassion in your heart, and most people do most of the time, identify a cause and support it. And if it's any one of the three of us here, we'll be delighted.
Ethan, over to you.
So, look, let me begin by just saying thank you to you, Salman, for bringing us together. You've been a great supporter of all our organizations and charitable work all over the world, I know. And so we're all very grateful for everything that you have done to get us together here today and to host this session. And you know what, finally, I would says. I think there is nothing better than saying, look, decide something that you can support. Find a way of supporting something, do something to give back. It doesn't really matter which organization it is, but try and do something decent, do something good, because you know what, we've been very privileged to get something in our lives, and it's a chance to give back is the main thing that all of us need to think about constantly, because the times are going to be even more difficult than before. The world is going to go through a really, really difficult patch. It's going to get worse before it gets better, I'm sure. So it's time to either dig deep into your pockets or to dig deep into your hearts to try and see how you can help those most in need.
Great. Rituji, once again, Javed, Hiten, thank you so much for enlightening all of us. I think from here on, we would again, I think, reconnect in some time and maybe perhaps, speak then about the development from there on we've had with this session. Because I think, this has to be continued. If it's physically possible, physically, if not till virtually, maybe virtually. Thank you so much. And everybody on the social media of Mukul Madhav Foundation for listening, and who else will listen to it on Barnardo's, on British Asian Trust, Mukul Madhav. And thank you once again. And till next time, goodbye. Thank you.